Have you ever started a new medication and suddenly noticed your hair falling out more than usual? You're not alone. Hair loss is a surprisingly common side effect of many medications, including a widely prescribed drug called prednisone. Today on the channel, let's dig into the relationship between hair loss and prednisone, explore the science behind it, and discuss some preventative measures.
To understand this complex connection, we first need to know a little about prednisone. This medication is a synthetic corticosteroid, meaning it's a lab-made version of a hormone your body naturally produces. It's a powerful anti-inflammatory drug, primarily used to treat conditions like arthritis, lupus, allergies, and even some forms of cancer.
There are a few reasons why prednisone might trigger hair loss. Here are some key ideas. Hormonal imbalance. Prednisone acts like a powerful hormone. It can disrupt the delicate balance of hormones in your body, potentially impacting hair growth cycles. Think of your hair like a tiny plant. If the soil, your hormonal balance, isn't right, it might struggle to thrive. Increased brittleness. While hair might not be falling out in clumps, some prednisone users notice more breakage and shedding due to their hair becoming brittle and fragile. Imagine delicate threads snapping under a slight strain instead of strong, healthy hair strands. Stress on hair. Prednisone can make your hair prone to damage. If you combine medication use with chemical treatments like dyes or perms, the stress on your hair can compound, leading to more visible hair loss.
Here's where things get really interesting. Alopecia areata is an autoimmune condition where your immune system mistakenly attacks healthy hair follicles, leading to hair loss. Despite prednisone sometimes causing hair loss, it can also be prescribed to treat alopecia areata. Why this apparent contradiction? Prednisone suppresses the immune system. So, in alopecia areata, it temporarily calms down the overactive immune response targeting hair follicles, sometimes allowing hair to grow back. It's a delicate balance within treatment.
If you're taking prednisone and experiencing hair loss, it's easy to jump to conclusions and blame the medication. But it's vital to remember that hair loss has many potential causes. Here's why it might not be solely due to the prednisone. Chemotherapy. When someone is undergoing chemotherapy, they often take prednisone alongside other powerful drugs. The other medications could be a primary cause for hair loss, not the prednisone itself. Radiation therapy. Radiation, while targeted at specific areas, still disrupts healthy cells. Hair loss, localized to the treatment area, may be more likely due to radiation than prednisone. Other factors. Conditions like stress, thyroid issues, or nutritional deficiencies can all play a role in hair loss. Don't worry, we'll get into how to figure out what's really going on and what you can do about it.
The first step is always consulting a doctor. They can help you pinpoint the cause of your hair loss and recommend a course of action. Here's what you might discuss. Changing dosage. Sometimes adjusting your prednisone dosage can make a big difference if hair loss is indeed a side effect. Alternative medications. If prednisone-related hair loss is unavoidable, your doctor might try a different medication. Topical treatments. Topical solutions like minoxidil are sometimes prescribed to help counteract hair loss.
If you're about to start a prednisone regimen and are worried about potential hair loss, there are proactive steps to take. Minoxidil? Starting treatment before taking prednisone may help prevent some hair loss. It works by stimulating hair growth. Biotin boost. Biotin supplements support the body's keratin production, the stuff your hair's made of. Stronger hair is less prone to breakage. Healthy diet. A balanced diet packed with nutrients is vital for healthy hair even without medication. When your body is happy, your hair is too. Think of your scalp as the garden for your hair. It needs good nutrients for strong growth. Stress management. Easier said than done, we know. But stress can absolutely affect hair. Stress management techniques, even simple ones like deep breathing, can make a difference.
This is the question on everyone's mind. For most people, the answer is a resounding yes. Prednisone-induced hair loss is usually temporary. You should see regrowth within a few months after finishing treatment. However, everyone's body reacts differently and the timeline can vary. The waiting game. Give it time. It can take anywhere from 3 to 6 months, sometimes longer, for substantial regrowth to be visible. Helping hands. The preventative tips discussed earlier, minoxidil, biotin, good nutrition, can help kickstart regrowth as well.
In rare instances, some individuals might experience more permanent hair loss due to prednisone. Sadly, it's difficult to predict who might fall into this category. If you have concerns, especially if you have a family history of hair loss, discuss this with your doctor before starting prednisone treatment.
Here's another interesting side effect. Prednisone can affect hair texture, both on your scalp and on your body. Interestingly enough, sometimes the effect is different at each location. Body hair thickening. Prednisone sometimes triggers hirsutism, especially in women. This means increased body hair in traditionally male patterns. It's a result of how prednisone can impact your hormones. Scalp hair thinning. Many people report their hair becoming brittle on their scalp, potentially due to prednisone's interaction with DHEA, a hormone that can shrink hair follicles.
Hair loss, regardless of the cause, can be emotionally difficult. You might feel frustrated, self-conscious, or anxious. Know that you're not alone. Many people have grappled with this side effect, and there's no shame in seeking help or support, whether from friends, family, or online communities.
I hope this video helped shed some light on the complex relationship between prednisone and hair loss. If you're facing this, open communication with your doctor is key. Remember, hair loss, while a hassle, is often temporary with prednisone. Please let me know in the comments if you've experienced prednisone-related hair loss. What helped you cope? Like and subscribe for more health-related content, and thanks for watching!